So the topic is decision-making from HTAi results, science or art. I will do this by asking two questions. The first question is, okay, how do evidence and values interplay in the complex process of HTAi to ensure rational decision-making? And to address this question, I think we have to investigate the rationality we use, the perspectives of acknowledging and handling uncertainty, and, of course, values. And the second question I want to address is HTAi-based decision-making a science or an art? So, and I will talk about decision-making in all levels. I will not differentiate. I don't have time to do that. The first question then is HTAi-based decision-making, is it rational? And let's have a short look at how we rank diseases according to their prestiges. Myocardial infarction, leukemia, spleen rupture has a much, much higher rank than anorexia, anxiety neurosis, and fibromyalgia. Is this rational? Some diseases tend to have a high prestige, other diseases do not. Those who are located to organs high up in the body have a high prestige. Those who are not, who are diffuse are not. And also, if we use advanced technology, this increases the prestige of various diseases. Is this rational? The classification systems we have, they have their rationality, but they don't work for all diseases. Rare diseases, special cases, this is not always very rational. We have preferences for certain types of interventions. For instance, here, where it says, welcome to your personal patient choice. For drugs, please press 1. For surgery, press 2. For tender loving care, try again later. All lines are busy. Allow me to quote both Francis Bacon and John Locke, who's written this, and they say, it is idle to expect any great advancement in science from the superinducing and engrafting of new things upon old. We must begin anew from the very foundations, unless we would revolve forever in a circle with mean and contemptible progress. So we seem to have some kind of bias. We think that the new is better than the old. There is imperative of progress here. We think that the advanced is better than the simple. We think that it's better to do something than not to do anything. We think that more is better than less. And we think that to know is better than not to know. We think that to choose is better than not to choose. Is that rational? We say that if you cannot count it, it doesn't count. Is that rational in decision-making? And we base our decision on evidence, although we well know that most of the published research findings are false due to publication bias. We weigh much more and pay more attention to what we can see and what we can count instead of what we can hear and what patients tell us. And of course, there are biases of shape and color, as you can see here. And we use technology all the time for other purposes than we really intended to. Is this rational? And we adapt to technology instead of adapting technology to our goals. Is that rational? And we have technologies looking for diseases instead of the other way around. And we use evidence hierarchies as if they are given in nature. And we decide what technologies to assess. And normally it's not this kind of technologies. It's more this kind and this kind. Is that always rational? So my question then is, what does this mean? Is decision-making on health technology, is it irrational? Is it arbitrary? Is it driven by hidden values? Is it all art and no science at all? This leads me to the second question. Is HTAi-based decision-making an art or is it a science? And this question is quite difficult because to differentiate art and science today is very, very difficult. We have science-based art, as you see here, and also here. And then we have art-based science. For those of you who know the Sokol affair, this is just one example. So the normative systems of science and art are blending. So it's very hard today to differentiate. The science-art distinction may be senseless. So the answer to the question of this conference, whether it's science or art, is maybe more difficult than we imagine. It has a trivial answer. Decision-making is art in the sense of we talk about state-of-the-art, but that's trivial. I think there are two non-trivial alternatives which I want to discuss with you. The first one is to say that, okay, making value judgments, that is an art. And this goes back to the debate on whether medicine is an art as opposed to a science, a natural science. And the second perspective I want to share with you is medicine as techné, in terms of the ancient concept of art, as opposed to arbitrariness and mere accident. And of course, many of you will think about and think of C.P. Snow with his book, The Two Cultures, the Natural Sciences and the Humanities, where there's a division, a deep division in many cultures between the descriptive and the prescriptive, between facts and norms and values, between what is and what ought to be, between nature and culture, and also between assessment and appraisal. So the option one then is to see decision-making as an art of value judgment. But then we need to ask what kind of values? And this conference has been a very, very nice display of these types of values. First, we have some basic values, which we share with most biological species. Then we have person-related values, and I don't have time to go into every detail of this. We have health professional values, different types, as you can see. And then we have health technology assessment-related values on various levels. And then we have decision-making values, which has been discussed during the conference. And then, of course, we have health policy-related values. So you see there are many, many values at play. And it's interesting to note that the study of values, axiology, it is actually part of ethics. So the first option then is to see HTAi-based decision-making as an art in terms of its handling of values. And we have to acknowledge that there are values of many kinds on many, many levels. The second alternative I want to share with you is decision-making as an art in terms of the ancient concept of techné. Art, the term art stems from Latin ars, but the Greek word for art in medicine is techné, iatrike, and we find this in the writings of Plato, Aristotle, and also Hippocrates. So techné is the same word that has given name to technology, which is techné and logos, the logos of techné. So the combination of techné and logos, we can find it also in the writings of Aristotle when he's teaching poetry. So what then is the characteristic of techné which can be of value to discuss whether decision-making based on HTAi results is an art? Well, the first characteristic is that techné is knowledge of a specific field. It has a determined subject matter, and it studies the nature of this subject matter. And techné is oriented towards a specific end, decision-making, for instance. It produces a useful result, the decision. And techné requires a mastery of general rational principles that can be explained and therefore also taught. So the second option then is to see HTAi-based decision-making as an art in terms of the concept of techné. So the conclusion then is that HTAi-based decision-making can be considered as an art in at least two ways, two non-trivial ways. First, as handling value judgments of various kinds, and secondly, as a techné. So decision-making from HTAi results involves a wide range of value judgments, as HTAi, of course, itself involves a wide range of values. So HTAi-based decision-making may be characterized as a science-based art. And of course, this makes you all to artists and scientists. But please remember, in the term and in the name of HTAi, this is an accountable interpretation of the arts. So if you want to know more about this, you can read it in a forthcoming publication. And there is a deep, deep distinction between science and art, and I think it is very important to acknowledge and reflect on this. Thank you for your attention.